In this video, we will talk about electrode system and how we place the electrodes while we are recording EKG for a patient. We actually have three main systems. The first system is the 3-electrode system, in which we use 3 electrodes only. And when we are using these 3 electrodes, they are the right arm electrode, the left arm electrode, and the left leg electrode. Please note that for the best result, we're placing the electrode on the chest wall equidistant from the heart. So the heart is here, so all of them are equidistant from the heart, almost equidistant from the heart. This will give us the best result, rather than the old-fashioned placement in which we put the electrodes on the arms themselves and the legs. We don't use this anymore. All right, when we are using these 3 electrodes, they will give us the 3 lamp leads, which are the bipolar leads, lead 1, lead 2, and lead 3 as well. Okay, so we have only 3, so the monitor will display only the bipolar leads, lead 1, lead 2, and lead 3. Okay, to have extra leads that we are going to explore, we have the next system, which is the 5-electrode lead. Now, the 5-electrode lead, from its name, it uses 5 electrodes. Now, the same 3 electrodes that we are using first, right arm, and left leg, but we need one more unipolar lead, which is either V1, V2, V3, V4, V5, or V6. But in order to have a unipolar lead, you need an earthing lead. And the earthing lead is always the right leg. Okay, so we add another lead here, which is the earthing. This does not give you any image to the heart. It's only 0 voltage. That meaning that if you need any unipolar lead, this will be in comparison to this right leg. Okay, so this is important. If you need any unipolar lead, you have to have an earthing lead, okay, which is the right leg. Now, so this is the 4th lead. The 5th lead will be one of the unipolar leads, any one you want, okay? So I will just use V. It can be here, so V1. If it is here, it will be V2. If it is there, V3, V4, V5, or V6, okay? So you can use any unipolar. So the 5-electrode system will only show you 4 leads, lead 1, lead 2, lead 3, and one of the unipolar leads, okay? So you need 5 electrodes to show all this, okay? The most comprehensive system is actually the 10-electrode leads, a system in which we use 10 electrodes. This 10 electrodes will produce 12 lead EKG. Now, what are the 12 electrodes? I have the 3 electrodes here, right arm, and left leg, and actually the earthing as well, because we will add unipolar leads now, so you need the earthing. So there are 4 electrodes on all 4 lamps, and you need 6 electrodes on the chest wall. They are precordial leads. What are they? The first one is actually the lead 1, V1. This is put on the 4th intercostal space. This is the 1st, 2nd, 3rd, and this is the 4th intercostal space on the right side of the sternum. Here's the sternum, to the right margin of the sternum. V2 will be on the same area, 4th intercostal space at the left margin of the sternum. And after that, we skip V3, we go to V4. V4 will be put at 5th intercostal space, mid-clavicular line. You go to the clavicle. At the mid of the clavicle, you would draw a line. This will be the 4th lamp lead, the unipolar lead, V4. Now, V3, now we go back to V3. It will be in between V2 and V3. Between V2 and V4. It will be almost at the rib itself. And after that, we go with V5. V5 will be at the 5th intercostal space at the same level of V4, and it will be on the anterior axillary line. You draw a line from the anterior axilla, and you will have V5. And V6 will be at the same level as well on the 5th intercostal space, but it will be on the mid-axillary line. You draw a line from the mid-axilla, and you will have the lead here. So in total, we will have 12 leads. Lead 1, lead 2, lead 3. These are the lamp leads. And after that, you will have V1, V2, V3, V4, V5, V6, and AVR, AVL, and AVF as well. Okay, so this is how we record all these leads from the heart. And that's it. Thank you.